And Dr. Sudhaa Sharma is the former Secretary to the Ministry of Health and Population in Nepal. She had also served as the President of Nepal Medical Association, President of Nepal Society of Obstetricians and Gynecologists, President of the South Asian Federation of Obstetrics and Gynecology, and Chair of Education Committee of the Oceania Federation for Obstetrics and Gynecology. She also has been bestowed with national and international awards, including a Woman of the Year award from FIGO for her contributions to women's health. She is the fellow of a Royal College of Obstetricians and Gynecologists in UK and holds a master's degree in public health. She has served as an advisor to the various UN agencies, especially WHO, and also the international NGOs operating in Nepal and abroad. She is a professor, and she was also a director of Parupakar Maternity and Women's Hospital, the public government hospital, very well-known government hospital in Kathmandu. And she also has served as the Chief of the Health and Nutrition in UNICEF Tanzania, during which she also served as the Chair of the Development Partners Group and contributed to developing health sector strategy plan there. More recently, she served as a consultant to the Ministry of Health and Population DFID funded project and led the development of safe motherhood and newborn health roadmap for 2030. She is currently working as a co-director in the CIWEC hospital situated in Kathmandu, Nepal, very well-known hospital among the tourists visiting this country. Dr. Sudhaa Sharma, now I invite you to make the presentation.
Good afternoon and namaste, everyone. It's great honor and privilege for me to represent CIWEC Hospital here in this gathering, and I would like to thank organizers for having CIWEC as a partner for the Himalayan Travel Mart 2019. Thank you so much. As you all know, Nepal is an explorer's paradise, and we heard in the morning about how the lure of Himalayas continue to attract people. Yeah, and because of lack of time, I will not go through the details of all my slides. Okay, the fact that I would like to focus on is health and safety, because I think we heard in the morning that from the National Geography, I think Ms. Quintus, I think you explained that among the other indicators for Nepal, health and safety were really at the lowest. So I would really like to highlight about how health and safety situation is in Nepal for the tourists. We had about 1 million visitors last year, and the aim is to double this by 2020. And again, we heard from Venerable Mr. Bhikkhu that if we keep doing things the way we're doing now, it's unlikely. So we really need to do better, and that is where the health sector would like to play a part and make Nepal really safe for travelers. So, yeah, and the challenge is, this is placed a bit, difficultly for me. So I'll just come here if you don't mind. Yeah, Tamar Deksa? Yeah, it's okay. So, so there is wide variation in topography, as you know, and the traveler preparedness may be inadequate, and there are newer guides, lack of trekker and guide education, and there have been deaths of travelers, which is really a tragic incidence, and there are risks to porters, local communities, and the environment. So we need to make it safe for everybody. Thank you. Yeah, and in terms of making Nepal safe in terms of health, the government of Nepal and the partners who are in this room, we are making great efforts to make Nepal safe for everybody. including all our visitors. There are local clinics run by the government at various places, and also those run by Himalayan Rescue Association, and more other partners are also coming into the sector now. And the health sector is working in close collaboration with travel insurance companies, hospitals, and tour operators. These are some of the pictures where rescue operations are done by multiple partners, some of whom are in this room, and I borrowed materials from their websites. The travel medicine is gaining ground in Nepal. Currently, there's an international travel medicine conference going on in Washington, D.C., and some of my colleagues from CIWEC Hospital are participating in that conference, and CIWEC, including other travel partners, are very much part of this international movement of strengthening travel medicine. And we are part also of the global network. If you see, Nepal is right here as a partner for the Sentinel site, which is located in Kathmandu. And travel medicine, I would not like to go into the details, but it makes travel safe, not just for the traveler, but also for cultures, for environment, for the regions that are being visited, and also by preventing disease and other adverse outcomes to the traveler. So how the travel medicine in general, and particularly in Nepal, is contributing is by preparing the traveler, including for vaccination, the ones that go from Nepal abroad and the ones that come to Nepal from elsewhere. You know, we can always guide them and provide them support. We provide immediate rescue and life-saving support. We also deal with migrant health and analysis of trends and patterns of infectious diseases through our research labs. That's a common thing that we do. And we are also analyzing the environment and health impact, including water scarcity, global warming, pollution, and so on, and the research on supporting development of strategies. So it was in Nepal and Himalayas that modern medicine, mountain medicine, made great advances in altitude illness. And these are all the scientific literatures which have been published, and there are many more. Because of lack of time, again, I would not like to go into the details. But I would like to highlight some of the current issues that have affected the travel industry here, especially the health sector as well. There have been claims that much more acute mountain sickness evacuations are being done. I think somebody alluded to in the morning that a bad apple spoils the entire basket. You know, there may have been some bad apples, but then the entire industry was somehow tarnished by people who might have had bad intentions. So, and there's a lot of competition nationally and internationally, as you know. So the implication was there is a nexus between the rescue, the tour operators, the health facilities, the helicopters, and so on and so forth. And it's claimed that there have been a significant financial incentives at multiple levels. And also there are myths and misconceptions related to medicines in Nepal. Oh, you don't get good medicine, there are not enough doctors, you know, the care provided is not so good, and so on and so forth. So in response to that, the government has been on top of all of this. There have been several meetings with the tourism board, with Honorable Minister, whom we saw yesterday, who passed away unfortunately, but the whole team of the ministry, and the partners who are in this room. We've really carefully monitored the situation, and government has been very firm in trying to monitor the situation and eliminate, asking partners to eliminate if there is any financial incentive, and really minimize or limit negative messages. And through this forum here, we would like to request you again to, you know, really understand the real situation and then make your own judgments based on reality and not just the publications that have come out in the international media. And then the institutions have to also institute self-audit and then strengthen public-private partnership for many other things, for quality assurance, training, and so on and so forth, which we have been doing in the health sector. So these are, again, some of the attempts made by the government. through the Tourist Search Rescue Medication Monitoring Guidelines, the guideline mandates that the local primary treatment is offered locally, and for further treatment, the person is sent to nearest hospitals. And then there are clear referral guidelines. So once the patient actually comes to bigger hospitals, with the descent, things might have improved. So it's really very hard for the hospitals to judge whether the evacuations were, done in haste or whether they were genuinely indicated. It's not possible sitting here in Kathmandu to make judgments. So we believe that the regulation set by the government is observed by everybody. And now, with this backdrop, I come to what CIWEC Hospital, that's where I am working, is doing. We started as a clinic in 1982, primarily dealing with travel medicine. Our director, Dr. Pratibha Pandey, she has years of experience working with Professor Dr. David Schlimm and so many other colleagues who are experts in travel medicine. And gradually we've grown to the current CIWEC Hospital, and my role there is to strengthen the surgical specialty within the hospital. So we are not just providing clinical care to the patient, and in that we provide all the first aid care as well as specialized care. For example, if there is fractures, trauma, or frostbites, or any other problem like acute surgical emergencies, CIWEC Hospital is able to deal with all of that. And not just CIWEC, there are multiple other partners and hospitals and providing very good quality services. Like I was told in the introduction session, I worked in Tanzania for almost 6 years. And let me assure you, the quality of health service here in Nepal and in Asia is much, much better than what is there in Africa. So rest assured, the quality of service that we offer is really very good. This is our hospital here in Kathmandu and in Pokhara, which is like a small boutique hospital, but then the quality of care we provide is excellent. Our commitments is to keep our visitors safe and healthy, offering the best possible care. So we would like to thank all our partners and thank you all for your kind attention.